connect the marginalized, the economically disempowered, the socially left out people in collectives and start changing their habits to improving their habits of financial management, savings, loans, credits, etc. So if you can change poor people's behavior in economic sphere, I'm sure you can change their behavior in personal and health spheres also. Last 10 years, including the work of our faculty, Somin Saha, he did his PhD on this topic. There is a lot of evidence which has accumulated to show that when health activities are added to microfinance activities or SHGs and microfinance, we see a double benefit: improving health behaviors, improving health outcomes. And now there are even double-blind published, double randomized published trials, community trials from IIPH-G and other groups in India as well as away in the world. In public health, we have been using this common simile called a leaking pot. It was originally developed for making up people understand the connection between nutrition, diarrhea, and health status. Many nutrition programs try to improve child's feeding by giving additional food like the ICDS and midday meal. But if it is like trying to fill a pot which has holes in the bottom, the child is continuously developing diarrhea because of the lot of environmental infections, open defecation, flies, other contaminated water, and whatever nutrition it gets is lost because of repeated diarrhea. And this was the example we used to give in public health many years ago to see why environmental health is important for nutrition. The same can be addressed or used for microfinance. You can't bring out people out of poverty if they keep on falling sick and losing money. It's also the leaking pot. Unless you plug the holes of disease and ill health, you can't really improve their financial conditions. All of you have come here, spent your precious time. We all thank you. I'm sure you will be sharing the experience and learning from each other, and we will also learn from your experience. I want to just highlight 2-3 points. Health is largely behavioral. Somehow even in India we get confused. When we talk of health, we think of a doctor and medicine. My sense is doctors and medicine is maybe 20% of what health is, and 80% is behavior, environment, and proper water, sanitation, and now even clean air. So, you are experts in changing people's behavior in financial sectors, and I'm sure with your help we can try to change people's behavior in the health sector. To take some few examples to emphasize how doctors and medicines are not important for health, recent literature and research has shown that the most important 2 interventions for neonatal survival, normal neonatal survival, is good, appropriate breastfeeding, and now what is coming as kangaroo care method, putting the child to woman's chest and keeping it warm. So in that sense, it is a highly behavioral practice which needs to be promoted, and we have tried it with MFIs and SHGs in UP with quite a bit of success. The kangaroo care, which is completely new behavior, changed from 3% to almost 30% over a period of 3 years in rural UP. Second example, clean water. In some sense, we think that water is water, and somehow as a nation we haven't made sure that all the water is potable in India, and that's why we have to use this bottled water, and it has become a fashion and a big industry which is adding to the waste and garbage, thus increasing the cost. There is an interesting micro business developed by an organization called eHealth Point in Punjab. They also found that Punjab has contaminated water. So they put up commercially viable micro enterprise of providing clean water through a village level system. So one could think of such micro level businesses which not only creates income but prevents diarrhea and makes people healthy. You can think of linking with nutrition programs, and government is now waking up that India is malnourished and not improving much faster. So there are many nutrition programs, ICDS, midday meal, special programs, many states have special programs, and how we can link people to those. We can think of care of the pregnant and lactating women. They are all physiological needs of a particular stage in life, and it is not disease or doesn't need much medical help. The fourth is whatever you do, some people will fall sick. Some people will meet with an accident and will require hospitalization, admission and catastrophic health expenditure. So we have to also think of how do we insure people against such rare but catastrophic illnesses. And that is where you saw the Sevas model, how they have developed a health insurance based with their women's groups. Finally, you could think of health product markets, because in some sense with the advent of ORS it became more and more clear that very small and cheap products can prevent a lot of deaths in children as well as in adults. And now the same ORS which prevented child deaths in the 70s in Bangladesh and then in whole of India and the world is becoming a panacea to prevent heat stroke deaths. If you see the literature coming because of the climate change, heat stroke, people are dying. ORS is the primary thing you need to give them because there is a lot of dehydration during heat stroke. Of course, cooling is the other side. So we have to think of what health products, including family planning, iron folic acid, over-the-counter medicines, including something very simple as nail cutter. Can we supply or sell it a nail cutter at the right price to each household in India? Similarly, very rapidly, what we thought is the conditions of the rich, diabetes and blood pressure, are soon coming, already come, and will start devastating the rural and the poor. And both of them can be sort of treated or at least identified and treated by very, very simple trained people. You don't need neither a doctor nor a nurse to measure blood pressure. Now there are many automatic measurement instruments available. The three things you need is a blood pressure measurement, a blood glucose measurement and a height and weight measurement to do BMI to prevent all the heart-related chronic conditions. The other simple things is examining the body to find early cancer. Breast examination, cervical examination, oral examination. Because we have so much of tobacco use, which is a major cause of oral cancer, alcohol use. So all of this